module 1 last time. Now we're doing module 2. If you want this book, you can order it, the print material, by this website, or you can call this number. I have some too. If you want, you can call me. Okay. Module 2 includes lesson 5, 6, and 7. Lesson 5 is sexuality and intimacy. Sexuality is a lifelong reality and a normal human need. Some situations of sexual expressions may or may not be okay. When you care for individuals with dementia, concerns may arise around consent, competency, and privacy. Those individuals involved in any sexual or intimacy activity must have a consent. If one individual is unable to consent due to a higher level of dementia, the two should not be allowed to engage in a sexualized behavior. If a person with dementia is unable to make decisions to protect themselves, there are procedures that allow family members to act on his or her behalf. Everyone has the right to express his or her sexuality without fear or judgment. Consider the person's decision-making capacity. Evaluate and make sure no one is being harmed. Look at and resolve any misconceptions or biases you may have. As you can see here, it's like all people having sexuality and intimacy. Sexuality is a feeling of sexual desire. It's an expression through sexual activity. It's sex drive, sexual act, gender, sexual orientation, erotism, pleasure, reproduction. It's the center and natural part of who we are through our lifetime. That's what sexuality means. Intimacy is giving and receiving love and affection, and like caring touch, empathic, understanding, feeling of safety, intimacy. Intimacy is closeness between people in personal relationship. That's what intimacy is. When you become too sexualized, the person with dementia, may no longer know what to do with the sexual desire or how to communicate the need to comfort, touch, or intimacy. So some behaviors, they appear sexual in nature. However, when examined closely, reflect a need for touch, intimacy, or something else. These are no sexual behaviors. So sexualized is when dementia, they act their private, they touch their private part, and it looks like they need sexual things from other point of view, but it's not really sexualized. Sometimes they just want to go bathroom, and the action looks different. That's sexualized. Do not harm is a big policy for our caregivers. The person's well-being is our primary consideration. The person with dementia has the same rights as all other people. A person with dementia has a right to be sexually active if he or she wishes, as long as it's not harming others, regardless of age, ability, and sexual preferences. So do not harm is our main one. Let's talk about attitude. Many adults' negative attitude towards sexual expression in late life. Caregivers may express anger or dislike toward individuals who engage in sexual behaviors. Most caregivers are uncomfortable with this topic and do not know how to approach the subject. So a negative attitude affects the expression of sexuality and quality of care provided. It also promotes embarrassment, confusion, and helplessness for the individuals. This is LGBT category. A stigma has occurred between same-sex activities more than opposite-sex activities. Combination of dementia and the individual from the LGBTQ can result in negative expression. It's our job as a caregiver to look beyond our own bias and find balance between protecting from harm, determining the individual capacity to consent to sexual activity or maintain privacy, and promoting independence. Before we go on, I'd like to touch what's LGBTQ in short. Lesbians are a woman who has a romantic or sexual orientation toward a woman, and these are called lesbians. And gay are two people of the same gender who love each other. It can be two women or two men. Most of the time, when two women are seen together, they are called lesbians, but they can be gay too. So in here, this can be gay and this can be gay, but the women they can also be called lesbians. And a transgender person is someone whose gender identity differs from that typically associated with sex when they were assigned at birth. Some transgender people who desire medical assistance to transform from one sex to another identity as a transsexual. And usually this is done by surgery. And queer are people who don't identify as a male or female. Queer is a word that describes sexual and gender identified other than straight or cisgender. Queer people as they go with everywhere, doesn't matter man or woman. Usually it's not like with the community is bad. Most people don't like it, even the LGBTQ society. Cisgender is most people who are assigned family at birth identify as girl or woman. Most people who are assigned as male at birth identify themselves boys or men. Those people are girls, they will be women. That's the cisgender. Heterosexual or straight is people who are heterosexual are romantically and physically attracted to members of the opposite sex. Heterosexual males are attracted to females, and heterosexual females are attracted to males. This is usually called straight. This is just to give you an idea what the LGBTQ looks like, just to make it clear. And there's two subjects that we need to know in here too: gender identity and sexual orientation. Gender identity is one innermost concept of self as a male, female, blend of both or neither. How individuals perceive themselves and what they call themselves. How do they identify? One gender identity can be the same or different from their sex assigned at birth. Examples: a person is born as male, but he wants to be called as she. That's gender identity. When you come to sexual orientation, it's like an inherent or immutable ending emotional or romantic sexual attraction to the other people. Sexual orientation is about who you are attracted to and want to have a relationship with. Sexual orientation include gay, lesbian, straight, bisexual, asexual, like that. Now let's go back to our topic in dementia. Dementia people sometimes they can have change depending on the part of the brain they have been damaged. Medication that might be taking a person with dementia could experience change, such as a reduced or increased interest in sexual aggression. And another one, inhibition. Inhibition is when the dementia people uncover their private thoughts and they might not be able to hide feelings and control behaviors as they did once. Example, they undress or touch themselves in public. Coping on frustrations. These are exercises or these are coping mechanisms, like exercise, physical activity, masturbation. They help them to reduce physical tension. Essentials are like client rights. Everyone has a right to express his or her sexuality without fear or judgment. Clients have the right to be who they are: gender identity, sexual orientation, sexually active, free from acting under duress. Clients have the right to have privacy, choose and reject partners, engage in behaviors different from past behaviors. If a person with dementia is unable to make decisions to protect themselves, there are procedures that allow family members to act on his or her behalf. A family member or another concerned person can also seek a protection or a guardian order. Consent is a permission for something to happen or agreement to do something. Both individuals involved in any sexual or intimacy activity must have a consent. And no threats, no violence, no constraints, or no other action against will or better judgment. These are free of duties. They have a right to be free of duties. Other abuse or other unacceptable sexual behaviors. Most of the time we have to ask the person with dementia if he's comfortable or if she's comfortable with a relationship, to avoid any unfairly treatment, or if there is any, if the person says no, I don't want it, and if the person is being treated with respect, dignity, things like that. So every time when this kind of things happen, we have to respect, we have to give them privacy to these people. Caregivers, what are the caregivers' responsibilities? We caregivers always need to advocate for the person with the dementia. Before touching a resident, any resident, you have to ask for their permission and make sure they are comfortable with your touch. Each individual may have different feelings about personal space and touch. Focus on behavior. Consider all possible reasons for the behavior. Provide privacy. Lead the person with dementia away from the situation and calm and gently or cover the person with a blanket to limit the exposure. Examine your behavior. Consider how you may appear to the other person, how your body language or nonverbal communication can be interpreted. If there is a situation that we have to distract the person, we need to redirect them to another activity if we have to. If we have to involve family, if appropriately, we need to do that. If approved by your supervisor on policy, speak to family about understanding and dealing with the situation. And seek advice if you have to. Ask healthcare professionals or other care providers for practical advice for dealing with sexualized behavior. We have some care tips. In the book is very nice, so I wanna talk about it a little bit. Do not take any sexualized behavior personally. Remember, it's often the disease, not the person. The person may have forgotten their marital status. Person may be expressing a need for touch. For example, if you see some bold behaviors like in flirtation, inappropriate sexual advance toward other, this person may be expressing a need for touch. It might not be something different. And sometimes you see a person disrobing, like taking clothes off in a public or unusual places, opening zippers or snaps or buttons. When you see this, you have to be attentive to toilet needs. Maybe this person wants to go bathroom. Assess for pain and discomfort, redirect behaviors, and provide opportunities for engaging in other activities. The person may be expressing a need to go bathroom, may be bored or maybe frustrated. Clothing may be restraining, irritating, uncomfortable. There might be a lot different reasons. If you see a dementia person maybe fondling, masturbation, may fondle him or her in public place, may masturbate in public place. When you see this, do not overreact. Approach the person in a calm manner and redirect the behavior. Provide privacy. You may choose to take the person to a private area or cover the person with a blanket or to limit the exposure. The person may have forgotten social rules and ethics, may not understand that the behavior is inappropriate in public, may be unaware of other reactions to the behavior, maybe doing this because it feels good or self-satisfaction. Sometimes you may see inappropriate touching of others, sex, hugs, kisses from staff, strange, may grab some people like that. When you see people like that, like especially dementia, do not judge the person. Redirect any inappropriate behaviors. Set limits if behaviors are sexually inappropriate. View all behaviors as a way that the person is trying to communicate a need. Always consider client rights. The person may be confused. Advance may be directed towards someone that resembles a spouse or lover or companion, may misinterpret other person's action and behaviors as the wanting to be touched. So when you see anything on dementia people, try to figure out why the person doing that. It's a caregiver obligation according to the Washington state law. It's a caregiver obligation to protect the health and safety of individuals by reporting all concerns of suspected non-consensual sexual contact and relationships. When there is a reason to suspect that sexual assault has occurred, mandated reporters shall immediately report to the appropriate law enforcement agency and to the department. Let's say about medication treatment and therapies. This is the next chapter, the next lesson. In dementia care, a combination of conventional medication, which means pharmaceutical drugs, medications, and behavioral management, and natural medicine, nutrition, or holistic therapies are used. All are used to help the person to maintain. All medications can cause side effects, so it's a caregiver job to watch for side effects and changes that happens to the person. It can be trouble breathing, trouble swallowing, high fever, bleeding, seizure, delirium. Most of them are life-threatening symptoms. Chemical restraint is considered abuse in the state of Washington. Individuals has the right to refuse medications. If the individual refuses to take medication, come back later and try again. These are like medications, these are like nutritions, these are like conventional medications, the doctor, and this is like the chemical restraints just talking about. Conventional medication. Conventional medicine generally use pharmaceutical drugs as a form of treatment. There are no drug treatment at this time for dementia. It helps to keep the person, but it doesn't cure it. Medication might be prescribed if a person is experiencing symptoms of dementia, such as memory loss, agitation, depression, anxiety, hostility, delusion, or hallucination. Some medication might alleviate symptoms, or some of them might slow down the disease progress. General dementia medications. Usually, cholestyramine inhibitors like donazepam, rivastigmine, and galantamine. These are the general medication that you see. The common names are like Arcept, Exelon, Razron. The side effects: loss of appetite, nausea, vomiting, diarrhea, muscle cramps, headache, dizziness, fatigue, insomnia. These are the general medications. And Nemantin is another one. Antidepressants, antipsychotics, anticonvulsants. These are the medications. So we as a caregivers, we have to watch for the side effects. We have to be a good observer. All medications have side effects. Report any side effects or adverse reactions to the appropriate person where you work. Life-threatening side effects like trouble breathing, trouble swallowing, high fever, bleeding, seizure, and delirium. Any life-threatening drug reaction or side effect should be treated as a medical emergency, so you have to call 911. Some of the medications are called extrapyramidal side effects. Symptoms like dystonia, dyskinesia, tardive dyskinesia, Parkinsonism, and akathisia. These are some of the symptoms. think when you see each medication you see, you will need to figure out what the side effects. So we can talk about them actually if you, but it doesn't really, just pass it. Chemical restraints. Chemical restraints is considered abuse in the state of Washington. The administration of any drug to manage vulnerable adult behavior in any way that reduces the safety risk to the vulnerable adult and others. Temporary effect of restraining the vulnerable adult freedom of movement, and it's not standard treatment for vulnerable adult medical or psychiatric condition. Individuals have the right to refuse medication anytime they want to. There are non-drug therapies that can help dementia. Pharmaceutical medications are not the only options for managing dementia. Non-drug therapies can also alleviate some symptoms of dementia, like natural medicines, like vitamins and supplements. You must observe and watch for any adverse reactions and side effects, just like the medication. The other non-drug therapies have some might have side effects. Cannabis or marijuana come from a plant and used as antipsychotic drug, but the use of medical and recreational cannabis is still illegal under federal regulation. So even Medicare doesn't approve it. There are a lot of holistic therapies. These therapies are a form of healing that considers the whole person, body, spirit, and emotions. These are like aromatherapy, acupuncture, massage therapy, breath light therapy, music therapy, pet therapy, sleep, Kong technology, international care technology. There's a lot of them to do it. Aromatherapy is use of scents and aroma of nature oils to alleviate a range of emotional and physical concerns, from stress and anxiety to blocked sinuses, pain, and cognitive functions. Scents from natural oils smelled or applied to the skin. Acupuncture is stimulating certain healing points to stimulate the body's own healing mechanism. The insertion of very small needle into the top layer of the skin and muscle. And massage is rubbing and kneading of muscles and joints in the body with the hands to relieve tension or pain, improve mood, reduce stress, anxiety, and even increase feeling of caring, comfort, and connection. Bright light therapy is the light therapy, gradually shift sleeping pattern to what we consider normal. And music therapy is the use of music to help treat and elevate range of emotional, cognitive, and physical concerns. And pet therapy help cope with health or emotional problems, makes them feel good. And Kwang is using exercise to optimize energy within the body, mind, and spirit, with the goal of improving and maintaining health well-being. Nutrition is diet, and nutrition plays an important role in maintaining health well-being. Nutrition-rich foods that promote brain health are like asparagus, avocado, blueberries, strawberries, coffee, colorful fruits and vegetables, extra virgin oil, fruit juice, lentils, other legumes, nuts, seeds, red wine, spinach, tea, and whole grains. Lesson 7. Activities of daily living. Activities of daily living, as you can see here, this person is sitting on the chair, on the bed, and this one is taking a shower, is walking, he's eating, dressing, toileting. These all are called activity of daily living. Activity of daily living refers to the basic tasks of everyday life. The activities include but are not limited to bathing, dressing, eating, oral care, toileting, mobility. Dementia changed a person's life and ability to complete ADLs the way they used to before the disease. Most of them, they can't do it anymore. You have the opportunity to make activities more person-centered rather than task-oriented. Most activities are very important because they help a person with dementia to express a sense of independence and control. Each person has a ritual and habit that should be learned and followed. When doing a single task becomes too difficult, simplify the task. Break it down to its smallest possible steps and give one step instruction at a time. The care you provide should be focused on each person as an individual. Then the dementia care activities. The interactions that go into the process of doing an activity. A meaningful process include activities that provide the person with dementia the opportunity to use his or her retained skills. So we try to have them work so they can remember stuff and experience and be reminded of past familiar roles and feel supported by the people around them, build self-esteem, stimulate physical senses. So these are just help them to do what in the past, whatever they know in the past, even if they don't remember, might help them to stimulate their brain. There are some strategies that are listed in the book. Individualized tasks and activities for each person based on a history. What's the best time of the day that this person does this job good? Encourage the person to do as much as they can. Use cues for a person who has trouble understanding. Use imitations to show by doing you do something the person copies. That's imitation. Use reminders. List signs as appropriate. Whatever way this person understands, we use it. Use diversion and distractions and make your home as a home-like environment. Plan ahead to make sure you have all the supplies you need before you start anything. Communicating a person with dementia may take more time and patience and energy. Some people ask the same question again and again. Nonverbal gestures can enhance communication. Nonverbals are communications without any verbal. Avoid or reframe open-ended questions that cannot be answered. So dementia people they cannot understand most things. So you should be expecting when you are asking them, you should be expecting answers from them like yes or no, not more than that. Avoid open-ended questions. Avoid reason, logic, or the mention of time because they don't understand it anymore. Ask rather than tell the person what to do. You ask them. Gentle deception. Agree with the person and allow the person with dementia to talk. Tell me more about it. I want to hear more. Remain calm and supportive, and do not take the behavior personally. Anything they do, what you see is because of the disease, because of the damage in their brain. They're not trying to hurt you or make you angry. Now we're just gonna talk a little bit about each task, so it might help. Assisting with bathing. Being undressed and washed by a stranger may be humiliating, frightened, and potentially traumatic experience for the person with dementia. Most of them they don't like water. A person with dementia thinks you are a stranger, trying to take his clothes and resist your help when you are helping him get ready for a bath. So when you are giving a bath, before a bath, follow the client routine. Know what time he takes a shower, and know the time of the day that's good for the client. Prepare the bath area before bath, and allow the person to be in control. If the person refuses, try another time. During the bath, give simple direction, one at a time. Encourage the person to do as much as possible. Observe the person feeling and reaction. If the person gets agitated, bring a pleasant topic or distraction. Speak in a low, pleasant voice. Preserve the person's dignity and privacy all times. Allow enough time. And after the bath, use lotion to dry the skin to help the skin heal. Observe the methods that work and do not work, and document it and celebrate every small success. Now let's see how we assess stressing. Getting dressed can be a very complex and overwhelming task for a person with dementia. Before dressing, warm the room. Observe the person feeling. Is he okay? Simplify the number of choices. Two shirts to choose from. You want this one or this one? Allow the person to choose. Choose clothes easy to put on. While dressing, preserve the person's dignity and privacy. Give simple direction, usually one step, and allow plenty of time. If the person resists, try again later. Assist with eating. A person with dementia may forget to chew and swallow, may forget to use silverware, or may have difficulty telling what is food and maybe pocketing food. Make time of meal very enjoyable as much as possible. Keep a regular routine. Keep noises at a minimum. Make the dining area comfortable. Allow plenty of time. Sit on the eye level. Or if it is on the same level, you can eat together at the same time. Make sure the food is not too hot or too cold. Most of them they lost their senses already. Serve food one at a time. Some dementia people they lose appetite because their brain is getting the part of the brain that's damaged might be causing that. So appetite loss, because they don't eat, they can lose weight and they can look of lack of energy. They will have a reduced ability to fight infection, and it's very hard for them to make problems with concentration even worse. So the common reasons for appetite loss might be depression, dementia, affect tasks, lack of exercise, difficulty with chewing, constipation, may no longer recognize food, sorghum, barley fitting dentures, clothes that's too tight. It might be. So encourage if this happens, encourage healthy snacks, offering sauces or seasoning to make the food taste better. Encourage physical activity, drink before eating, serve 4 to 5 meals throughout the day, and offer energy-rich foods. And sometimes dementia people they will be overeating, and that means a person with dementia keeps eating because the person may not remember he or she already ate. And so for this kind of people, give 5 to 6 small meals per day. Involve the person in activity as a distraction, and low-calorie snacks are available. Chewing and swallowing problem. What brings chewing and swallowing problem? The cause, a person may forget how to chew and swallow, or the dementia person might have a dry mouth that makes swallowing very difficult. Discomfort from a gum disease, other dental problems, ill-fitting dentures make chewing difficult. And so we need to consult with our supervisor, or swallow evaluation might be needed. Have the person get a dental checkup of gums, teeth, and denture. Notify the doctor if choking problem develops. Assisting with personal hygiene and oral care. A person with dementia may not recognize the need to brush teeth. Let the person brush his teeth or her teeth as much as possible, and assist as needed. Use soft toothbrush. Adaptive grips toothbrushes are available if needed. Do not rush. Remember to brush the tongue too. While helping with oral care, always watch for sores in the mouth, loose or broken teeth, bleeding, bad mouth odor. It's also very important to observe any dental symptoms of a teeth pain. like rubbing his or her cheek, jaw or cheek, moaning, shouting, rolling head, nodding, refusing hot or cold drinks, being restless, refusing dentures if that's not the problem before. Assist with toileting. A person with dementia may not recognize the need to go to the toilet, may forget the toilet, may not recognize the toilet, may forget to use the toilet properly, may not recognize the bladder is completely emptied. There's a lot of things we can do. One is like we need to put a sign on the toilet door to show that's a bathroom. Keep the toilet way clear. Simplify closing. It's easier for the person in the dementia to go to the bathroom and use it. So clothes like with elastic waistband or Velcro is better. Or we can use a commode or bathroom if the bathroom is too far. Color toilets might help. So when the person with dementia is incontinence, some stuff that we can do, like could the person to use the toilet at a regular time, watch for nonverbal cues, try toileting first thing in the morning and before bedtime, and try toileting before and after each meal. Respect the person's privacy and dignity at all times. Avoid using the word diaper. Use brief or any other acceptable word. Diaper it's considered bad. Most people they don't like it. They're it's like babies, so it's understandable. These are references that I used. Thank you very much.